Welcome back to Medical Monday.
Yes.
This week's topic is going to be one that affects about 10 to 20% of all Americans, kind of about the same ratio and numbers that we see with low back pain, but this is neck pain. So still the same joint structures, your spine, but at the very top it holds your head.
Yes.
The number one reason why we have neck pain is degenerative joint disease. Meaning that joint's degenerating.
Yeah.
It's going away.
I'm not a huge fan of the A word, but that's the same thing as arthritis.
We like to have 4 or 5 different terms to confuse patients.
Yes.
But yes, arthritis, osteoarthritis, degenerative joint disease, they all mean the same thing, and it's all because that joint space is not healthy and is not functioning properly, and now those bones are deteriorating.
Gotcha. Absolutely. Now, before we start confusing everybody with everything that we're going to talk about with neck pain, let's make sure we tell them to like, share,
Oh, yes.
and comment.
Because you, like I said, 10 to 20% of people will get this. That means 80% of the people listening won't even have this.
Nope.
However, the 80% of these people that don't have it probably know somebody who does.
Yep.
So if you like and share it, you'll be able to send that information to them so that they will know about their disease, things that they can do to help with it, and all those other options that are out there for them.
Yeah, and that's what we're here to do. Educate the masses.
Yes.
Let them know what your problem is.
What is the neck? We want to be the better alternative to Google. WebMD is great, but you know it's a rabbit hole sometimes. It's very confusing, and we want to get out of the nitty gritty. So, what actually is causing this neck pain?
Yes.
Why do we have it, Dr. Gabby?
Well, with any joint, if it moves, it has muscles involved, right?
Yep.
Literally, in every joint, it's not a joint if it doesn't move. So, we have muscles, we've got structures underneath those muscles, and there's 7 bones that stack on top of each other that allow our neck to do different movements, literally. And so what it is just the neck is from this area here, right? This is a great explanation from a chiropractor as far as I'm concerned, right? Now, we talked about the structures. Underneath all of those muscles that you just saw in that picture is what this is from the front, all right? And what happens is there's holes that exist between each of those bones to let nerves, arteries, and veins come out so that there's good communication, so that there's good flow. And when we have arthritic changes, there's pressure on those things. And
when we look at arthritic changes, so complicated picture, very easy model.
Yes.
So look at the disc and the big hole that this fat disc is provided for the nerve to come out. That nerve is very healthy because the fat disc creates a big hole that the healthy nerve can come out. Now this person functions well and is very happy. This patient, not a fat disc, meaning that hole is gone, and now the nerve, look at the size difference of this little fat nerve coming out of there and that little skinny choked off nerve. Now one's got dysfunction and one doesn't. Oftentimes patients will have this. We talk about the degeneration for many years before it gets to a point to where they notice it. But even just the weight of a dime placed on that nerve, we see through studies that they don't function very well downstream. So think about it. A dime doesn't weigh anything. That little pressure, think about this hole getting smaller and smaller. Then think about the dysfunction that you can have.
Yeah, and that's great. And I love to use the word dysfunction creates dis-ease. So over time, that dysfunction can actually cause issues in other areas as well. So I love to correlate those words together quite often.
But as a chiropractor, what about another big neck condition? We have whiplash.
Whiplash. It's probably one of the most common because you see it quite often in athletes from old injuries, but then also people are like, oh, well, I was 4 years old and, you know, my mom got in a car accident and I was in the back seat, but I didn't have any issues. Well, yeah, you did. And there's a particular area you see degenerative change with whiplash injuries. So it's actually, I like to call it my, just like magical skills that I just know. I'm like, oh yeah. Like, did you ever have a whiplash injury? Oh yeah, how did you know that? Well, I just know things.
I looked at your films.
I did.
They told me the story.
Yes.
But because joints deteriorate over time, whiplash is a traumatic event. Sometimes we'll notice it a little bit sooner. But because these joints deteriorate over time, it's a slow process. And oftentimes patients have a hard time remembering, and they're like, well, I think in college I did, play football, but that was 20 years ago. So, it's hard sometimes for patients to connect the dots, but it's very true when we do connect those dots as far as why we're in this situation and we're at. And even like this patient with the nerves that are running down to their hand, like, well, my hand, the strength is not there, something's not right. Well, you trace those nerves back, and where do they come from? They come from the neck.
This area right here.
Yes. So that is where we trace back the history or mechanism of injury.
Yes.
To 20 years ago, I played, softball, my, adult teams on the weekends, and, I played pretty competitively and might have had some neck injuries. Like, it makes a lot of sense now. We tie that together because the injury 20 years ago, now we have that degeneration, that space closing off to a point to where you're noticing it.
Yes, exactly. And the nerve is communicating that radicular symptom that, hey, there's something wrong. So, and the same thing, headaches. Structurally, there's a lot of things that exist in this area. And with that can come a lot of different types of headaches and different types of recovery. Sometimes it can be a nerve-based headache. Sometimes it can be a tension-type headache where it is truly more muscular-based. And, you can have even pain-type headaches where due to the amount of pain and stress you're under physically, your body is releasing hormones that's just not allowing you to recover. And you get symptoms like that. It's unpleasant.
Very unfortunate.
Yes. And then we've mentioned it many a times.
There you go.
A lot of different types of degenerative change that exists through those. So you can see the healthy discs over there by Lonnie. And then you can see the different types of degenerative changes that can exist. And what happens with these degenerative changes as well is a lot of times you see, now this is an MRI, but you can see that some of these have outpouchings that push onto the nervous system. And so that's called a disc herniation. There's different types of disc herniations, and they can land at any level of the spine where there's a disc located. So there's a lot of different ways that we can have different types of neck pain. And then sometimes our neck pain or neck problem can be in our hands. Or in our head, or in other ways. So
where those nerves come out from your neck, they go throughout the body, and they have for certain functions they should do. And if where they come out of the neck, if there's pressure on them, we'll see that downstream. Unfortunate for the patients, but it really leads us to what's going on, so we can figure out what exactly that particular patient needs to get better.
Now, the next session are things that you can do at home to help with some of the symptoms you're experiencing, or if it's one of your first times ever experiencing this type of neck pain or type of symptom. And one of the best things that I know everybody loves hearing us say, so it's definitely worth a share, is ice. Ice, baby.
Yes.
Ice where it hurts. Ice where it doesn't hurt. Ice it to help you recover. So it's just a phenomenal way to help numb the area, decrease the inflammation, and let your body recover very efficiently.
What else is there? Well, we have to have some stretches. We need to have movement in there. A Cochrane review noted that movement was great, but then they also needed to have exercise as well. You can't just do one. And it really is beneficial to have that full range of movement, but then also some good exercise for those muscles. You've got to have both.
Yes, and yoga, these are a lot of different yoga poses and just over, upper body type stretches that exist. But there's lots of resources online that you can look up great neck or upper body stretches. And then also modify, plan, do, review, reevaluate. There's just so many things you can do to help modify what you're doing. If you have a desk job, maybe it's important to find some things that are more ergonomic to get your arms in the right position. Being a female and having had 2 children, I can tell you right now, sometimes things just pull me forward. So we have rolled, pull those shoulders back because we don't want to be those little old folks in the nursing home that can only look at the floor. Man, that's some nice tile you guys have here. And so, no, pull back. So review, look and figure out what positions or what activities specifically cause you to have the most symptoms, and modify and change. And then test the water, see what happens, and modify some more.
I know one of the big things that we see now is electronics. So kids, and I say kids, I'm in my 40s, so unfortunately 20-year-olds are still kids to me. But I see them on their phone a lot, and it just takes a simple reminder, hey, pick your phone up when you're looking at it, not down. That'll help your neck stay as healthy as possible, because you just see more and more. I can't tell you, just in the last couple of months, I've had 30-year-old females come in, and they already have a hump on the back of their neck. that, of course, I would be self-conscious about too, especially for a 30-year-old female that is far too young to start seeing that hump occur. It's not a natural thing that should occur anyways, but if it was to occur, it should occur in a much older female, not within a young 30-year-old patient.
Correct.
But
cosmetically, that is occurring earlier and earlier and younger and younger. And, there's a specific type of curvature that exists or should exist in the neck. And what we're seeing more and more frequent in younger and younger patients is what's called a reverse curve, which is literally your neck should be curved like this, but it's curved like this. And so that is something that needs to be addressed, because we talk about disease. Well, that or dysfunction, that's going to cause disease if you're, structurally, you're modifying your skeleton.
If you're putting stress on the nervous system, it's going to have dysfunction in multiple ways. Your nervous system not only moves muscles, but they also function for the heart, the lungs, everything that comes out from the neck. These nerves, they function, vital body functions also within that area. So you don't want to have dysfunction of those nerves, period.
You want them to just be supported in as many ways as possible. So some things we can do as well, not just at home, sometimes we need extra help, is rehab. Sometimes it's super important to just find a professional that specializes in positioning, what specific muscles, what movements, and then even professionals that can help with ergonomics. You can see this gentleman has his hands on the handles higher up so that the shoulders have less stress on them as well. So there's just a lot of different aspects when we talk about rehab and exercising to strengthen the neck and shoulders to get those types of results and, move forward with things.
Of course, we talk about pain medication because it hurts, right? Your neck hurts. It's difficult to turn it. But the other part of medications we need to look for is that oftentimes we prescribe antidepressants for people that are in pain. Why? Because it's depressing to be in pain. So, we want to get out of pain and not look for, ways to just kind of mask that symptom or the symptoms of the symptom, which would be depression. We want to actually get back to that function. Going back to the Cochrane review, talking about the movement and the exercises, it's very important for that to have good function of your neck. Yeah,
and that's depressing to know that it's depressing, that you have to prescribe depressants for
depression.
I'm
telling you.
It's just
a rabbit hole.
It is a rabbit hole.
We don't want patients to go down.
Correct. We can also do injections. There's different types of injections that exist. You can do nerve blocks in the neck to help with different types of headaches. You can also do joint injections to help, essentially a steroid injection to reduce the pain, reduce the inflammation where that arthritic changes. But what these don't do is they don't actually address to fix the problem and get the movement. We talked about, movement, exercising. It actually releases endorphins to help prevent the depression. So, but sometimes they're needed to get the relief. Yeah. This all exists for a reason. And then, in very extreme cases,
we don't like seeing these.
No, they're just sad. Yeah. But they're needed. All of this exists for a reason, especially in emergencies or if, really it becomes so unstable. But fusions are needed and necessary in cases where it's just too far along or
or there's a traumatic event. That's where I would rather see more surgeries on the traumatic event, because obviously that's, a traumatic event. It needs some type of fixture to it versus more of a degenerative event. So something that has gone on for years and years and years without proper treatment, those are the surgeries I don't like to see. Yeah. Traumatic event, I understand. Yeah, but letting it go to a point of this is something, it's near and dear to us. We don't want to happen. And because there's other great options. There's a lot of options for you, the patient, to know to where it doesn't have to go down that path.
Correct. We try our absolute best as in our mission to avoid surgery.
Yes.
It is in our mission. So
how do we do that?
Yes, absolutely. We've gone over some of these things. Rehab is a huge aspect. We've gone over different aspects of rehab and exercising at home under professional supervision. But also, this is something that we do here in the office specific to what's going on and really honing in on what of those muscles and what of those movements need to be best executed. Is it really just the shoulders that need to be pulled back? So let's pull and engage those muscles. Is it something structural and muscular in the neck? All right, so let's start working those, head nods, there's a lot, chin tucks. There's so much that you can do rehab-wise to help strengthen here in the office.
The School of Rehabilitative Science noted from the faculty, they did a big study in the health science department related to movement and how well function is improved by having that exercise and proper muscle function for the neck.
Yeah, and it's so important. Muscles move joints, and they're also pumps, which is where decompression comes into play. Right? You guys have heard us talk about decompression numerous times, and what this does is helps to rehydrate that disc space. Just because we have arthritic change or degenerative change does not mean that that joint is Dunskies. It actually means that we need to work that joint, strengthen those muscles, and decompression is actually a great way to open up that joint space to allow it to have better movement and get pressure off of those structures that are being affected, that are causing different symptoms down the arm.
Yep.
Yeah. And then also trigger point injections.
Trigger points.
Yeah.
So Dr. Gabby said that muscles move bones. That's true. Well, the muscles are very tight and tense, and you felt those knots up in your shoulder.
Yeah. Everybody has that friend that has their shoulders attached to their ears.
Well, you're in a stressful job. You have kids. You're breastfeeding, and now your arm is just stuck there. There's a lot of things that occur that have muscles that lead to muscle dysfunction. The problem is not treating it. So how do you treat it? It's just relaxing them. You do it with a trigger point injection, very simple. We use a natural anti-inflammatory instead of taking a pill that can have side effects. It's a natural anti-inflammatory right into that muscle. We say just relax. Just melt it like butter to where you can get good rehab, good adjustment, and great recovery, and help speed the patient along.
Yep, that's exactly what it does. And then also there's adjustments. This is something that's super important to get movement in those joints specifically. And then structurally, we rotate our tires and align those tires regularly because you want to get the best wear and tear and miles out of those tires, but also your car as a structure needs to be supported properly as well. So adjustments are very similar in that manner. We need to get movement in those joints so they can move properly, get those muscles to engage properly, and then also just be supported above and below. We have movements everywhere that are what's called compound movements because there's multiple directions we can go, especially when we talk about the neck. So lots of different techniques that can be utilized here in the office to get you adjusted. Some of them from, something as gentle as using a tool like this, all the way to a little bit more aggressive, with that popping and snapping that a lot of people know about when they think about chiropractic adjustments. So what I want to share most about what we do for just about any care plan when a patient comes in here with an issue or a problem is the comprehensive approach. There's typically not a single answer that's going to correct it 100%. It's a matter of really looking at the big picture and taking that comprehensive aspect to make sure we look at it structurally. We look at it, from a soft tissue perspective. We look at it from almost a chemical type perspective when we talk about getting those muscles to relax. It's a comprehensive aspect to really make the best results happen for that patient.
Your diet, how well are you going to recover through the process? What is your occupation? What are some of the hazards you deal with on a daily basis? And what are your goals? Your goals are related to function. And that your functional goals are what they are. And that's going to help us drive a specific care plan for you, whether it's, we talk about the marathon runner, or we talk about somebody who just wants to go to the grocery store but not have to ride in the cart.
Yeah, absolutely.
Your goals are your goals, and we're just here to help focus with those. So we're a very specific, comprehensive plan for you.
Yeah, for you or your neighbor or your mom or your loved one or your cousin, anybody. So make sure you like and share. That is Medical Monday on neck pain. We always absolutely love recording these for you guys. So enjoy, and we'll see you next week.